see you. Hey, boy, you've been making all kinds of. I've been trying. It won't reach my mic. My wife doesn't let me.
Good morning. Welcome to Oriole Park at Camden Yards, home of our beloved Baltimore Orioles baseball team. Today we're here to celebrate the launch of an important milestone in the fight against COVID-19, one that will have us hopefully back in this ballpark full of fans, full of cheering, and hopefully full of home runs, right? Joining us today are some of the VIPs of Maryland's COVID-19 story, some of Maryland's trusted leaders and strong voices in their local communities. Voices that will help us carry into the next phase of recovery and hopefully back to normalcy. Governor Lawrence J. Hogan Jr. was sworn in as the 62nd governor of the state of Maryland on January 21st, 2015. And then in 2018, he was overwhelmingly reelected to a second four-year term, receiving the most votes of any Maryland gubernatorial candidate. He's no stranger to tough times, though, and now leading us into one of the most difficult times of our lifetimes. Today, we focus on hope that we have in moving forward, and Governor Hogan will make an exciting announcement. Governor Hogan, sir.
Well, thank you very much. Good morning, everybody. Thank you, Rob. Good morning to all of our distinguished guests. It's really great to be here in Baltimore City at this iconic ballpark. I know that each one of us has a long list of things that we're looking forward to doing once this pandemic is finally behind us. For me, and I'm sure for many Marylanders, one of those things is coming back here to Camden Yards when the weather is a little warmer, or maybe much warmer than today, when we can fill all of those seats out there and all of the bars and restaurants and the streets outside with tens of thousands of enthusiastic O's fans. And that day is coming. But the only way we get there, and the only way we bring this pandemic to an end, is through these safe and effective COVID-19 vaccines. With our mass vaccination sites beginning to open next week, today the state of Maryland is launching an aggressive grassroots public outreach campaign to promote vaccine confidence and to urge Marylanders to get vaccinated when it is your turn and when vaccines become available to you. I'm honored to be joined today by a few of the trusted leaders who will serve as some of the ambassadors of our Go Vax campaign. This campaign will include medical experts, academic leaders, educators, faith-based and nonprofit leaders, business leaders, first responders, and community advocates who will all share their perspective and their personal stories about the importance of getting vaccinated in order to help us encourage others to do the same. One particular area of focus for this Go Vax campaign and our statewide vaccination plan will be tackling the initial vaccine hesitancy that we see in minority populations and underserved communities, which have been disproportionately affected by this pandemic. With the completion of her mission in Washington, commanding our troops, protecting the nation's capital, I'm pleased to announce this morning that General Janine Burkhead has agreed to now serve as the leader of the Maryland Vaccine Equity Task Force. General Burkhead will work closely with these ambassadors and with state and local health officials to ensure equitable access to COVID-19 vaccines throughout the state of Maryland. The Go Vax campaign is one of the single most important things that any of us will ever be a part of, because as we are able to encourage more and more Marylanders to get vaccinated, we will be able to move closer to returning our state to a sense of normalcy. To help get us there over the next several months, we will be taking this campaign to every corner of every community, to TV, radio, billboards, social media, Zoom, whatever it takes to promote the safety and efficacy of these COVID-19 vaccines and to make sure that Marylanders know that getting vaccinated is the best way to keep you, your family, and your community healthy and safe, and to save the lives of thousands of Marylanders. We are all in this together, and we are going to bring this pandemic to an end together. Thank you.
Thank you, Governor Hogan. Maryville's own Brandon M. Scott. He is the 52nd mayor of Baltimore, working to end gun violence, restore the public's trust in government, and change Baltimore for the better. Mayor Scott is a rising star in politics, as we know. He was a member of the Young Elected Officials Network and served as the Secretary of Housing and Urban Development for YEO's American Cabinet. He also serves as the chair of the National League of Large Cities Council. Mayor Scott is a community leader, a public servant, and a lifelong resident of Baltimore City. Most importantly, he's a proud Baltimorean. Mayor Scott.
Thank you. And while Rob is a fabulous announcer, he is a better basketball coach. So thank you, Coach, for that introduction. Good morning. I'd like to thank Governor Hogan, the Lieutenant Governor Rutherford, and welcome everyone to the great city of Baltimore, and specifically to my favorite place in Baltimore, Camden Yards. And Mr. Governor, you are right. There is nothing more in the world that I want to be back in this stadium watching the Orioles beat the Yankees. And we will get there. We will get there, and it will be much warmer. Baltimore City continues to work each and every day to grow our capacity to vaccinate Baltimoreans efficiently and effectively. Vaccines, as you heard, are one of the most critical tools we have for ending this pandemic. Here in Baltimore, we have a plan in place for mass vaccinations, mobile vaccinations, and providing a second doses to those who have received the first round. Recently, we leveraged our partnership with our hospitals to accelerate the vaccination process for our teachers, work with the governor and our state partners to open mass and prepare for mass vaccination sites here in Baltimore City. But we know it is through partnership with the state, our hospital partners, and the community that we will be able to ramp up capacity in the coming weeks and months. We must also recognize the power of information and the importance of credible messengers. We know that since the start of this COVID-19 pandemic, there's been misinformation spread from what should have been credible sources. But with new leadership in place at the federal level and the steady leadership at the state and the city level, I am encouraged by what we are seeing, including greater transparency from the White House around COVID-19, the plan and recent purchase of millions of more vaccines. I am also encouraged by the demand for the vaccine on the part of Baltimoreans and residents across the state of Maryland. It shows responsibility and dedication to the health and safety for those around us. I know that together we are fully prepared and moving swiftly to vaccinate Marylanders as rapidly as the supply allows. My administration here in Baltimore will continue working with Governor Hogan and our state partners to stand up capacity in the city and, of course, across the state. We also will redouble our community engagement and outreach efforts. That means working with community leaders, businesses, faith leaders, and residents to answer questions about the vaccine and address any hesitancy around taking it. As I've stated since the start of this pandemic, I will continue to advocate for the health and well-being of all residents. But my administration remains committed to a coherent, collaborative, and equitable approach to mass vaccination in Baltimore and beyond, particularly for our black and brown communities who have been hit hard by this pandemic and are experiencing a disproportionate amount of deaths from the pandemic. For our older adults who lack the access to online systems that we use for appointments, we have to and we must continue to battle this public health pandemic through a lens of equity. We know that here in Baltimore and across the state and across the country, there has been hesitance in our black and brown communities. We must operate through a lens of understanding that that hesitance is actually based in truth and fact on things that happened in the past. And through credible messengers, through things like GoVax is how we're going to work with our communities to make sure that folks are doing the right thing, and that's getting vaccinated. I want to thank Governor Hogan for his work on behalf of Marylanders and remain hopeful that we continue to see the data trend downward here in Baltimore City and across Maryland. Thank you.
Thank you, Mayor Scott. Our next series of speakers are proven and trusted leaders in their communities, on the ground and in the day-to-day battle against COVID-19. First would be a man I watched walk the walk my entire life. That's the Bishop Walter Thomas. He served as a pastor of the New Psalmist Baptist Church in Baltimore, Maryland since 1975. Under his leadership, the church body has grown from 200 to more than 7,000 active members. Next, there'll be the Dr. Freeman Rubowski. He served as the president of UMBC since 1992 and is a national leader in the research and education with special emphasis on minority participation and performance. Dr. Rubowski participated in COVID-19 clinical trials to help increase vaccine confidence in the African-American community. Then there's Brigadier General Janine Burkhead, you heard Governor Hogan talk about, the Assistant Adjutant General for Maryland and Commander of the Maryland Army National Guard. She is also a senior advisor in the Office of the Special Trustee of American Indians at the Department of the Interior in Washington, D.C. And then there's Dr. Kathleen Page. She's an associate professor of medicine at the Johns Hopkins University School of Medicine with an expertise in infectious disease. Dr. Page has made it personal and professional goal to make healthcare more accessible to everyone, especially our underserved communities. And then there's Delegate Jocelyn Pena Melnick. She's represented Prince George's and Anne Arundel counties for 10 years and serves as a vice chair of the Health and Government Opportunities Committee and is the founding member of the Maryland Legislative Latino Caucus. Bishop, the floor is all yours.
Thank you so much, and let me start by thanking our governor and our mayor for giving us trusted leadership, not just this week or last week, but since the start of this pandemic, their voices have rung clear to help us understand what needs to be done, and we could trust what they say. I stand to speak, as do others, about the need to take the vaccine. I thought to myself, what were my options? Since this vaccine is hit and I am in one of the higher categories, I thought, what are my options? I can take the vaccine, I can get the virus, I can get sick, I can die, I can spend the rest of my life in my house. Given those options, there was only one worth taking, and that was the vaccine. And because we haven't seen our children and grandchildren in any close way, in a state that is marked by festivals and fairs, and a city that's marked by neighborhoods and coming together, it means so much to be able to hook up, to share with your family, to share with your friends, to be in the stadium, to be in the street, to have the block party, to have the backyard barbecue, all of which has been silenced over these last 12 months. But now, through the vaccine, we have an opportunity to do those things that matter so much to us, and we can open our eyes and see this possibility. I want to thank the leaders for making sure that there's going to be enough vaccine in our area and enough vaccine in our community so that when you decide to say yes, there will be a place to be vaccinated. Thank you so much.
Well, if I hadn't already taken the vaccine after hearing the bishop, I would be sure and take the vaccine. This is a morning of hope for our country and for our state. We are so privileged to have a governor, a mayor, and other elected officials faith leaders, educational leaders, medical leaders, who are saying the same thing. We're in this together. And I am privileged as an educator to be at a university that just created the first black woman in the world to create a vaccine. It's a huge message for the world. Dr. Kismikia Corbett is a graduate of UMBC, lives in Maryland, is leading the team at NIH in the development of and it was she who said to me, we've got to get more people of color, blacks and others, in this trial, in the Moderna trial. And so my wife Jackie and I participated in phase 3 back in September. And we found out in the last few weeks that what we got was the actual vaccine. In that trial, you have the placebo group and the people who actually get the vaccine. And here's the point for all of you. We're doing this not just for ourselves. Anybody who takes that vaccine, we're doing it for everybody around us. We're doing it for our children, but especially what we know about this vaccine. We're doing it for our mamas and daddies and our grandmothers. And so it's not just about me. It's about all of us. And that is the message in taking this vaccine. You do it to make us better. We are so fortunate in the state of Maryland. Thank you.
Amen.
Thank you, Governor Hogan. Good morning, everyone. I'm glad to be back at home in Maryland after supporting our neighbors in Washington, D.C. We can all be proud of our service members, those citizen soldiers who answered the call of duty in the nation's capital in their time of need. To Maryland National Guard Task Force Capitol Ground soldiers, I'm so proud of you, and remember that you are truly a part of history. Deploying on a no-notice deployment mission to the Capitol took adaptability and professionalism. These men and women did not go unnoticed. They have upheld the proud tradition of being a citizen soldier. They earned the appreciation from those getting off the metro at Columbus Circle to the leaders in Washington, D.C. and America. I want to thank them for their sacrifice. The Maryland National Guard is always ready. We're always there. We know our work is not done, however. Even as we were in Washington, D.C., our fellow service members were back here helping with the COVID vaccine. Their efforts right now, they're hardworking and working with the Department of Health to support the administration and the vaccine distribution. With patience and perseverance, we will get through this together. I have received the vaccine, and I can tell you that it was no different than receiving the flu shot. The benefits far outweigh the risk, and it brings us one giant step closer to returning to normal. I encourage you to please read the science. If you have questions, speak to your physician or your pharmacist. These are unprecedented times, and we spare no effort in getting the vaccine to the public, but we need your help. When it's your turn, get the vaccine, make your appointment promptly, and don't miss it. As a tremendous task the vaccine effort is to our communities, it is an effort that we must overcome. These aren't strangers helping us. These are our family members and friends, our neighbors and our community. Governor Hogan, thank you for the opportunity. I pledge to you and all the citizens of Maryland that I will have unyielding efforts to ensure this life-saving vaccine is distributed and reaches those in every community, equitably and rapidly as circumstances allow. Thank you very much.
Hi everyone, I'm Kathleen Page. I'm an infectious disease doctor at Johns Hopkins. I am so thankful to the governor and the mayor for inviting me to be part of this hugely important initiative. As an infectious disease doctor and a bit of a nerd, I have read the studies on all the vaccines in detail, and this is the good news. This vaccine is safe and it is so effective. It actually has exceeded all our expectations. Unfortunately, this last year has been so difficult for many of you, especially communities of color. And I have had the privilege to serve in the medical field to take care of patients with COVID, but I also have been heartbroken so many times to see so many people suffer so severely, die away from their families. And then really, I cannot express how difficult that has been to so many of you. But there is light at the end of the tunnel, and this vaccine will make a difference. If we all work together, I think we can put an end to this hopefully soon, so that we can do the things that matter so much to us, be together with our friends and family. And what I ask everyone is to please, our responsibility in the medical profession is to give credible information, the right information. We will be here and ask questions. We want to give you the right information so that you can make the right decision for yourself. And when you take the vaccine, tell your friends, tell your relatives, because no one is going to convince others more than those who love each other. So do it for yourself and do it for the people that you love. And very quickly, because many of my colleagues know that I work a lot with immigrant communities, I want to say one small message in Spanish, which will be that together we can do this. A nuestros hermanos latinos en nuestra comunidad que han sufrido tanto con esta pandemia, les quiero decir, esta vacuna es segura y es efectiva, y que juntos vamos a poder poner punto final a esta terrible tragedia. So just to make sure everyone understands, I just said that together this vaccine is effective and very safe, and together we can put an end to this tragedy. Thank you.
Good morning. So I'm the last speaker, so I'm standing between you and the door. So good morning, Governor Hogan. Thank you for having me here today. And distinguished guests, it is an honor to be with you. So everything has been said. I can tell you that for me, it's very personal. It's very personal that you get your vaccine. Like many of you, I have lost people that I love, like my father, like my cousin who used to call me every week to say, how are you? I said a prayer for you. Like two of my friends, one of them who was out there with me for more than 4 months doing food distribution this past summer, who was a healthy man. So you can prevent this. If you just, when it's your term, you trust it and get the vaccine. For the first time, we Black and brown people participated in those clinical trials at great numbers. So please get it. Do it for you. Do it for your family. Do it for your friends. Please, so that we can build enough community immunity, so that we can again hug our loved ones, give them a kiss, feel that warmth, so that we're not lonely at home, so we can live, so we can travel, so you can spend time with a good friend, having a nice cup of tea. Please get your vaccine. It is free. It doesn't cost anything. And for the Latino community, whether you're documented or undocumented, we're not going to ask you for any proof of citizenship. That is not needed. You don't need identification. You just need to prove where you live. You don't have to pay for it. The information won't be shared. So please trust it. And we're going to make sure that we think outside the box, that we go to the churches, that we go to the communities. Por favor, ténganle confianza. Cuando le llegue su turno, vacúnese. Hágalo por su familia, hágalo por sus amigos, hágalo por la comunidad. Es importante que usted se vacune para que se proteja. Gracias. Thank you.
Correct me if I'm wrong. I think I heard you right, Bishop. You said when this is over, there'll be a backyard barbecue at New Saunders. Is that what I heard? I thought you take note of that. Thank you, Mayor, community leaders. First of all, I'd like to say, concerning the vaccine, I have trust issues. So initially, I was skeptical of it, didn't want to take it. And as Mayor Scott said, I coach at Mount Carmel High School. And one of the administrators, Mike Norton, asked me, why do you wear your mask? And that's why I wear my mask, to protect others. He said, that's the same reason you get the vaccine. And I started thinking about the kids that I coach and I'm around every day, and my family, my friends, and I thought, okay, that's the best reason to get the vaccine. So at that point, I was on board, and I look forward to getting a safe vaccine and being around my family, my friends, and getting back to normal again. So I'm hoping that we can do that as soon as possible. So I encourage you also to do the same. Thanks for joining us, and go Vax Maryland. Before you leave, we have a video to show you.
Go Vax. Let's end COVID, Maryland.
There will come a day when this will be behind us. I am optimistic that the vaccine is one of the steps in a bright future.
A lot of people are questioning whether we have enough data to say that whether this vaccine is safe. But there's something that's really important for everyone to know. There were no shortcuts. Scientists from all over the world dropped what they were doing so that they could help with this.
We've been taking vaccines our whole lives. They've been approved by the same government, the same processes. Let's move forward and get back to real life.
And when people say this is an experiment, no, this is the best of science coming from the most informed experts in the world. Follow the science and get the vaccination.
Though we've made tremendous strides to develop the COVID-19 vaccines, it doesn't matter if we can't get Americans to accept them. I was among the first Marylanders to receive a vaccine, and I'm confident about its safety and effectiveness.
Every day, COVID-19 vaccines become available to more and more Marylanders. When one is available to you, please get vaccinated.
It's not just about you. Think about doing this for our community.
So that my family, your family, our friends and loved ones can move forward and that we can eradicate COVID-19.
Taking the vaccine gives us a reason to do hope and a reason to be proud.
The vaccines are here. They're effective and will be available to all Marylanders. No questions asked. Getting vaccinated is the best chance we have for ending the pandemic.
We can end COVID-19 together.
사랑하는 사람을 지키기 위해서는 백신을 맞으셔야 합니다.
Vaccinate and protect the people you love.
This vaccine works.
Go Vax.
Let's end COVID, Maryland.
Protéjase. Proteja su familia.
Go Vax, Maryland, to protect yourself, your friends, and your family. Learn more at covidlink.maryland.gov.